Hey everybody, welcome to the Fired Up with CJ show. Today we're going to be talking about your heart and how to make sure that you have a healthy and happy heart. And guess what? One of the things that is actually not great for heart and increases heart disease is stress. We're going to talk about stress and heart disease, in particular during stressful times like this, during holidays, how some tips to actually get you to be more in the spirit of Christmas, which is peace, love, and understanding. so today we have Dr. Cynthia Thaik, and we're going to be talking about her book, Your Vibrant Heart, Restoring Health, Strength, and Spirit from the Body's Core. So welcome, Dr. Thaik.
Thank you, CJ. It's great to be here.
So I wanted to talk about first, just get an overall understanding of how stress, we know about diet. Well, I think most of us know about diet and exercise and, smoking, how those are things that are not necessarily good for our heart. And I think we sort of probably know on an intuitive level that stress is not good. But what are the studies? How do we know that stress is not good for our heart?
I think that stress is interwoven to every presentation for heart disease, whether someone's presenting with high blood pressure, diabetes, cholesterol, the known physical, diseases that are typically associated with heart disease. Interlaid always is, work stress, emotional stress, the relational stress. And I would say that 90%, not just of heart disease, but really of all the diseases that are out there, stress has been associated with diabetes, certainly tied in very well with high blood pressure. On a vascular level, stress causes blood cells to demarginate. It causes endothelial dysfunction. On a metabolic level, it has an impact on insulin and how insulin plays within the body. It leads to insulin resistance, certainly leads to elevated blood sugar, metabolic syndrome,
Right.
high blood pressure, elevated blood pressure, heart rate, etc.
Yeah, so I see how it's interrelated. So if I'm stressed out, I may be eating more. If I'm eating more bad stuff, probably it's not super good. I'm probably more fatty, whatever. It is interwoven. It's probably impossible to just extricate it as stress. So there's no equation or studies that they've shown that show stress correlates to this kind of heart disease.
Well, there's plenty of studies out there that relate stress to heart disease.
Yeah, but it's not. But it's
Absolutely.
because it's so interwoven with all these
But it's
things.
interwoven to all the other metabolic parameters.
Yeah.
Absolutely.
Okay.
Yeah.
Yeah, like my husband has like a cholesterol level where they measure it, and he was just trying to figure out whether he should get statin or not. And they said, well, your number is this percentage, and this is the number that we recommend, that it won't have an effect or have an effect. So it was a very algorithmic kind of specific thing. But stress, because it's interlaced, is kind of this subtle stressor that no one probably sees, is what I'm hearing. That they know intuitively, but it's kind of hard to like mark like a certain percentage, like stress is attributed to X percent of your heart disease.
That's right. That's right. It's not like a number that as blood pressure or high cholesterol where you lower it below 200 or you lower your blood pressure below 140. We're
Right.
not going to be able to equate it in that
Yeah.
manner.
And that's hard, right? Because then you have to convince your patients that it matters. So how have you been able? Because when I was looking at your website, drcynthia.com, there's a bunch of different case studies of people who are like, well, I've come in here, and you've said, and people have come in here with these recurring heart issues, and the only thing that stops is from them coming back again is stress. So tell us a little bit about the anecdotal evidence that you have from your patients.
Yeah. All too often, patients want to have a physical reason for their ailment or their symptoms, right? And so
Yes.
when they go and see a doctor and they're having chest pain or palpitation or shortness of breath, they want somehow intuitively, psychologically, it it's easier for them to believe that there's a physical ailment.
Right. Yeah.
Okay, it somewhat takes the responsibility off of them, and
Yeah.
and it is a much harder deal. And I think that's why patients come to see physicians more than mental health professionals.
Right. Just give
Often,
me some medicine that you can
and
stop it. Yeah.
exactly. And so the realization that stress is always going to be around. I mean, there's always going to be taxes. There's always going to be other people with their personality, work environment, etc. And so it's really understanding that stress is from within rather than without. Okay, and so too many people want to think that the world is happening to them, that things are happening to them, rather than recognizing that how they choose to relate to the world, how they choose to have their perception, it changes everything. And so when I speak with patients and when I see patients, and you're laughing here, it is first, evaluating them and first of all making sure that their physical heart is indeed okay, but then threading that gentle water of making them realize that there is a huge connection between the mind, body, and spirit.
Right.
And unless they're willing to tap into those issues and get more connected to their inner spirit, inner guide, that unconsciousness of them, and really look at how they are perceiving the world, then they'll have a harder time.
Well, one of the things in your book, Your Vibrant Heart, that you talk about is that there are all these dimensions of the heart, right? There's the spiritual heart and the physical heart that you're measuring, and then there's the emotional heart. So what are those things that we're not as familiar with, the spiritual heart and the emotional heart? What are those dimensions mean? And how do you measure them, or can you?
Yes, absolutely, you cannot measure them, and then that's why I do think that the focus tends to be on the physical heart, the dimension that you can see, okay? But as you said, intuitively, we know that our emotions have a tremendous impact on our physical heart. And there is such a thing as an emotional heartbreak that then can lead to a physical heartbreak.
Wow.
And so I tell my patients, the body is very complex, right? But every thought, every emotion literally leads to a huge cascade of hundreds, if not thousands, of neurotransmitters, cytokines, inflammatory markers, the good hormones, the bad hormones, the neuropeptides. And it literally plays a symphony within your body, and it creates the very milieu by which your heart and your blood cells sits. And certainly there's been a lot of research, like Dr. Emoto research on water, where he showed these water crystals, and depending on whether you wrap the bottle of water with love and gratitude and appreciation and high vibrational words versus words of anger, hostility, and stress, the very crystals of the molecule change. We know that Bruce Lipton's work from the biology of belief, that while there is genetic predisposition to heart disease or genetic predisposition to high blood pressure or diabetes, our biology of the belief will change the expression, genetic expression.
Right.
And so, whereas in the past, people want to think, oh, I'm hardwired to get heart disease, or the familiar history is there. The recognition that how you choose to hold yourself, how you choose to think, how you choose to feel, how you choose to act, will really change the natural history or the course of your illness.
Yeah, and I'm betting on that. My dad sadly died of a heart attack 20 years ago, and he drank. He didn't drink. He smoked. A lot. He smoked cigarettes, and he worked out. He did a lot. He was eating okay. He wasn't eating awful amounts. He had a good diet, but I actually think what killed him was the stress levels. It was the stress levels and the smoking, which and at least I'm hoping that with all the meditation that I do, and I eat healthy, I exercise, I'm hoping that all those things in fact are changing my genes, so that even though I may be genetically predisposed for a heart attack, I may actually be changing those particular things, and hopefully if my thoughts are changing those things too.
That's right. And it's really important for you to hold that as your thought, that you have a vibrant heart. And that's why I titled my book that way, Your Vibrant Heart. Because for me, I very much believe that a vibrant heart is the birthright of every human being. We come into nature with this amazing, not just physical heart, but like I said, an emotional heart that's capable of so much love, so much gratitude, appreciation. Our mental heart, people talk about the mind and where does the mind exist? Well, most people will point to their head, but the brain exists in the head, right?
Mm-hmm.
The mind exists within our body. And because I am a cardiologist, I like to think our mind is really heart centered. And
Yeah.
particularly with the Asian culture, right?
Yeah.
We the belief really is that the mind exists within the heart. We speak about our heart speaks. We feel with our heart. We speak with our heart. Our emotional center of our heart,
Right, so that's
our
kind of a more
intelligence center.
spiritual sense about like
Yeah.
in a lot of the different Eastern practices. I think what you're mentioning is this kind of the sense that the mind as our ultimate intelligence, our intelligence that incorporates our body's intelligence, our mind's intelligence, all this kind of stuff is all kind of centered here, right? It's interesting because I talk about it being a center. If you take the Eastern as in the Hindu, you have all these chakra systems, and your
Right.
heart is at the center of where the earth and heaven meet, what would a Taoist would say, and a Hindu would say the first and seventh chakra meet, but it's at the heart. And is that what you mean by spiritual?
That's right. That's
Okay.
right. Absolutely.
Yeah.
And so it's so important for patients to come back to being centered, to being balanced, to being present in the moment. I mean, those are the sort of the spiritual or the lifestyle practices that I very much teach and try and steer my patients towards.
Yeah.
It is so easy to write the prescription. And even like you said, yes, diet is important. Yes, exercise is important. Those things are important. But equally important, if not more so, is having lifestyle practices.
Yeah.
You
And
know,
especially like you said, because they're all interlaced too, right?
That's right.
Because if you reduce the stress, it actually affects, your dieting too. Because if I'm stressed out, I'm going to eat more carbs, sugar. It's like you said in the very beginning, it's all interlaced.
That's
So
right.
if there's one thing that, but I'm not hearing you say don't do the other things. I'm hearing you say do all those things, but also change your lifestyle so it's less stressful.
Yeah.
Yeah. Okay, so here's the thing that's kind of interesting because we talk about stress, but I don't know if everyone really knows what stress is because I think it affects people differently. I think there are a couple common things, like when people are stressed out, they seem to talk faster, they rush around all the time, they're doing multiple things at one time, they're yelling at their kids, and they're maybe not sleeping so well. I mean, what are some signs that you've taught your clients about so that they can even be aware that they are stressed? I know that seems like a weird thing to ask, but how do we become aware that we are stressed?
Yeah. I think that for most of us, we let our unconscious, our subconscious, run this tape recorder.
Mm-hmm.
Right, and that people have talked about the conscious and unconscious mind, and really only 7% of our brain function is consistently conscious, and so it's our subconscious that is really running the show.
Right.
And so learning to connect the conscious and the subconscious, learning to pay attention, learning to be present and mindful. I always tell patients about Emerson, saying, stand guard at the portal of your mind, right?
Mm-hmm.
And really be acutely aware of your thoughts and your speech, etc. And when you start doing that, you'll recognize, and I tell people, it's really very simple. As you start monitoring your thoughts, does this serve me? Is this thought an empowering thought? Is this a disempowering thought?
Yeah.
Right. And when you start trying to distinguish those two, and anything that is above the zero mark in terms of positive vibration is going to lower your stress. Anything that is below that mark and leading into the negative vibration is going to increase your stress.
Okay.
And then there's the physical signs that you talked about. Your hair standing up, the palpitations, the faster heart rate, the increase in blood pressure,
Right.
the sweats, feeling tense. And so, and while you're absolutely right, it doesn't, stress doesn't have a numerical marker like high blood pressure or blood sugar. I think you can pretty much ask anyone, and they can know when they are stressed.
But
That's true.
I think that like you said, some of the physical things are probably more obvious, like tightening of the throat or the stomach or kind of tensing of the shoulder. People do this
Right.
fight or flight thing. They either go like
Yes.
this or they're going like this. Both of them are reactions to being stressed or trying to show power in a particular situation or run away. But I think that the thing that you brought up that I really like is the idea of the idea that if we are our energy and we vibrate at a certain level, is a thought bringing us into a higher vibration or a lower vibration? And if the thought is going towards a lower vibration, then I know that's causing stress, right? That's not
Right.
good for my body. So it's
Yeah.
trying to figure out what to do with that thought.
And I think it's really important to bring people to the awareness that they get to control their thoughts.
Right.
Most people, don't have that belief.
Mm-hmm.
They think that, like I said, the world's happening to them, that they're not in control. But the truth of it is, the thoughts are created in your head.
Mm-hmm.
And at the very minimum, if you're not able to shift it into a positive vibration, I always tell patients, there is a pause button. You go, pause. And literally, and I do this. I tell people to take your finger and press it against your forehead and literally do a pause the way you would do a tape recorder and pause that.
Right.
And just that act alone will get them centered, will bring them back to the present moment.
Yeah, that's like the 93% of the tape that continually plays the same song over and over again. It's like, pause. Is that a high vibration or low vibration? And if it isn't, like, the idea of kind of either a minimum pausing or recording over the tape what you would really like to think, I think that that's the hardest thing, like that. In preparation for your show last night at 1:00, I woke up and I had an awful day yesterday. I've had a lot of deaths that have been happening. So just stressful. I mean, death is stressful, right? So I'm kind of a stressful day last night, and I wanted to prepare for this interview, and I had actually 2 or 3 interviews I'm preparing for. It was totally stressed out. I was thinking, okay, what other questions going to ask something, and then the other questions going to ask this other guy, and my whole brain, and I went on like that. Honestly, I looked at the clock when I got up and I thought, this is ridiculous. And I looked and I thought, I've been doing this crazy, insane thought dance for an hour, for 1 whole hour. And I thought, that is pure insanity, especially for someone who has the skills. And I thought, I need to like clear this toxic waste dump that I've developed in my head. And in my case, I used emotional freedom tap, and I don't know what kind of so I used. So I'm like, even though I'm full of anxiety, and I'm just. And actually, after I cleared out all of cleared out my cache, I would say, of like full of discursive, unhelpful thoughts, and then I thought, okay, well now I'm clear and I'm way more relaxed. And then all I did was I just started imagining myself shining with white light, and then I just boom fell asleep for the rest of the evening. But it took an hour to identify, and this is for someone who's in the business, so to speak.
Yes.
To do it. So it's not an easy thing to do. And I've been on a spiritual journey for, in various stages. Like I've been working, with steady progress on, a nice little curve. But, it took me an hour. I mean, it's hard. It's hard to do.
You were in the process for an hour, but the awareness only took you a second.
Yes.
Right? So it isn't that it took an hour to get to that. When you allowed yourself to pause and become present, then the awareness was immediate, right? Now, and that's because you are in the business, and so Right. For other people who are not as skilled, it might take them longer. But I tell people that change occurs in a minute, right?
Yes,
people talk about it took me years to quit smoking. No, it took you years to make the decision, right?
Yeah.
But the decision occurs in a second.
Yeah, that is absolutely true, and that is the most, frankly, freakish thing of all. that I could be having this one belief that I believe so firmly, and that was 100% correct. There's no part of my body that disagrees with this, and I can actually do work, energy work or breathing or meditation, and it's usually with energy work for me. I think everyone has their own modality, but I can do energy work And at the end of it, I truly believe that that's not true. And it literally, it could be 3 minutes of a
Mm-hmm.
tapping or an energy technique, and it's gone. And it's
Mm-hmm.
shocking. And then you think, oh, that I'm not sure if that worked. That's just an anomalous thing that happened within those 3 minutes. But then you find yourself a week later, you're still acting and behaving differently. A month later, you're acting and behaving differently. You know, I just talked to a client that I worked with just before this phone call, and she said, you know, we worked on those things, and she said, but I'm still having issues. And I said, but let's actually go back to the actual issues that you said, the thoughts that you were having. Do you still have any of those thoughts? And she said, well, no, actually. And I'm like, are you reacting in this particular way? Are you relating to it in this particular way? And she
Mm-hmm.
said, no.
Yeah.
But she was still getting, but she's like, I'm still irritated and annoyed. I'm like, this is no miracle. You're still going to have emotion. You're still going to have emotion. So you're not going to be all peaceful and zen all the time. But
Right.
it is miraculous that it can be
Yeah.
in a matter of seconds. Okay, so what are some of the warning signs of stress? Like when do so part of it is watching your thoughts and being
Mm-hmm.
conscious and aware of your thoughts. The other is kind of looking at your physicality. But are there certain warning signs like you're saying, like when your cholesterol gets over this level? What is there a stress related indicator in your mind?
Stress shows up differently in each person.
Mm-hmm.
Okay, and so one of the things that I teach is learning how to connect to your own intuition, your
Mm-hmm.
own intuitive system, your inner guide,
Mm-hmm.
learning the language of your body.
Mm-hmm.
Okay, I will certainly tell you that the heart is a center where a lot of people show their emotion, their stress. And so the physical symptoms are with the heart, chest pain,
Mm-hmm.
palpitation, shortness of breath, dizziness, okay? But the stomach is another area, stomach knotting
Mm-hmm.
up, the gurgling, the discomfort, the abdominal pain. The head is another common area, headaches,
Mm-hmm.
the feeling that tension, right?
Mm-hmm.
And so you have to listen to your body. I tell my patients, there's the conscious and then there's the subconscious, and you want those two things to communicate, but clearly they don't, and that's why there is that division or chasm there, right?
Yeah.
The body sits at the interface of that chasm. And so when your body speaks to you, when you have physical symptoms, it is your body it's your unconscious trying to communicate to your conscious
I see. Got
level
it. Yeah.
that something within you is not in balance.
Yes. Oh,
Okay?
that's
And
perfect.
and and all too often, patients come to a physician for an answer about their physical symptoms, and they should absolutely do that.
Right.
So, don't misunderstand me and not thinking that they need to go to a physician. But beyond going to a physician, if they've gone to a physician, that physician has done the workup and everything looks fine, they go to another physician, everything looks fine, that's when it's time to look within yourself because you're the best authority on your body.
Yeah.
And so what is the message that your body is trying to tell you?
Right.
And as you get quiet, as you meditate, you become present, and you keep asking that question of yourself, the answer will show up.
Yeah,
And
and
you
it
know
really
that.
does. And it's
Yeah,
unbelievable sometimes that you think that's weird, but my body is actually if you literally I don't know how you do it or you suggest people in your programs do it, but I actually ask like heart, what do you need right now? And it will answer. What I need is more fun or something will occur. I asked one time I was asking my body, what do you need right now? My body said
yeah.
you need more you need I can't even remember, it was like you need more minerals. And then it said the mineral that you needed was, and I don't even remember what it was, but a word that I didn't even know existed. And it's a mineral. And I went into the Whole Foods and I said, do you by any chance have a mineral called this? And they're like, yes, here's the bottle. And I just thought, that's amazing. Like, how did my
Isn't
body
it?
even know the word? I don't even
Yeah.
know. It's amazing. If you,
Isn't
yeah,
it amazing?
yeah,
That is the truth of it. Is that truly you have all the answers that you need. It is there. It is not. It might not be in your level of awareness,
right.
but the answer is there.
Yeah. And I think the point that you made is really good. Tune into, like, it is going to speak to different people in different ways. For some people, it may speak in, and I think the way that you described it is perfect, is that there's an imbalance. Something is out of harmony, and it's going to show you in your physical body, right? Whether it's
That's
your
right.
head or your heart or your stomach. Some people, when I talk to clients, it's
Uh,
often their throat. Because
yes,
they're, and
yes.
especially at work, because they're not saying the thing that they want to say, like, that person's driving me crazy, I don't know what to do. It's like,
Yeah.
that's kind of the thing that shows up in their throat. But yeah,
And
it does show in all those different places.
yeah, and I can share with you a personal story regarding that. The knot in the throat, which is very common. It's called globus hystericus.
Mm-hmm.
Knot in the throat. It's usually in young women. But when I was in medical school, I had this lump in my throat,
Mm-hmm.
and I went to bed with it. I woke up with it. I was having trouble swallowing. Young medical student, and so of course I went and saw all these physicians, and they did all sorts of studies on me,
Yeah.
echoes, brain scan, all of this stuff. And then one day I was leafing through Harrison, which is this huge, textbook, like 300 pages, and it says
Yeah.
globus hystericus, knot in throat. And I said to my mom, who's a psychiatrist, by the way, Mom, globus hystericus, knot in throat. She said, yeah, I know. I said, what do you mean you know? And she said, had I told you that, you wouldn't that I wasn't being supportive. You would have like been angry at me. You needed to find this out on your own. And I
Wow.
tell you, that very day, that very moment that I read that, my symptom went away. And
I
this
just
was a
got
symptom
chills. I
that,
got flushed all over. That's
yeah,
amazing. And I believe
yeah,
that that's so. I mean, it's not always the case where it goes away in a particular day. Like my husband had some heart issues. Like he has heart issues, but I think some of them are spiritual and emotional. And he actually worked on those issues. He's like, I said, when we kept on saying, well, should you go to a heart? I'm like, should you go to the doctor? I'm like, I don't know. He's like, I'm going to try to work on it energetically or emotionally. And he did. And those palpitations and things went away. Now, I don't know if that's advisable. I don't know as a doctor if you'd advise that, but that's what he did.
I always tell patients, check out your physical heart. I mean, that is the first
Yes.
key. But then after that, but once the checkup, if the checkup doesn't reveal a physical abnormality,
Yeah.
then be open to the fact that there is these multi dimensions of the heart,
Yeah.
and look at the other facets.
Right. Go to
Yeah.
a shaman or go. I mean, what do you suggest? Do you have a program? Tell us about your program.
I do. I have a coaching program
Mm-hmm.
that I do that is based on, much of the work that, Mary Morrissey and Bob Proctor and Jack Canfield all doing is really about finding your vision, your purpose, your
Mm-hmm.
passion.
Mm.
It all centers around that,
Yeah.
right? We talk about people being stressed or people being anxious or depressed is because they don't have a directionality to their life,
Mm.
or because they're not balanced, or because they haven't found their true inner spiritual purpose.
Mm.
Okay? And we all come into this life with a purpose. The
Yeah.
sad thing is that most of us exit this life without ever truly, discovering and fully
Right.
living to their purpose.
Right.
And so it's a magical thing when you can do that. And that's, I know that that's the work that you do, and that's the work that
Yeah.
many of us in this field of life coaching does, is help people journey to really discover their inner self. Okay.
Right.
Now, in terms of what do I advise beyond that, I'm really big on cognitive awareness. And
Mm-hmm.
so rather than necessarily sending them to a hypnotherapist or a Reiki therapist, the
Right.
first thing I invite patients to do is to go to the authority that is your authority,
Mm-hmm.
yourself. That heart's intuition, that
Mm-hmm.
inner guide.
Okay, so you would
Listen
work
to
with someone
that.
who would train you on how to tap into your intuition. First, believe it's true, but then once you believe that it's true, using it as a guide, because that's the body's it's another form of the body's intelligence if we only knew how to talk to it. It's there.
Absolutely.
Yeah.
Absolutely. And then from there, once they get curious, then they can find their own path. I mean, in my book, I list so many different modalities and
Yeah.
avenues, right? From energy healing to crystal to light therapy, meditation, yoga. And obviously, there are practitioners that are very skilled, whether it's EFT, emotional freedom tapping, the energy healers.
Mm-hmm.
But rather than my guiding someone to a particular route,
Mm-hmm.
they'll know once they, they look at the book and read through it and experiment with it, then just listen to their heart
Yeah.
and see what aligns. And then the answer will be there.
And I guarantee you, go to my website, www.firedupwithcj, because I've probably talked to whoever you're, whether it's a Reiki person or an energy healer or a shaman. I mean, that's part of, because everyone has, like you said, a different path that will work for them. And then I also say that some people have different paths that work for them at one point, and then another path will work. So it's not necessarily a clear, delineal, line that goes through. Okay, so I think we've covered some of these things. I wanted to talk to you about how the holidays in particular and how we can deal with holiday stresses. You've been seeing probably patients throughout, as the ramp started before Thanksgiving to now. What would you say are the typical things that people are stressed out about, and what kind of advice would you give them?
Yeah, the holiday season is when we have the most heart attacks.
I was going to
Okay,
ask you
and
that. I
yes,
wondered. Wow.
and for a number of reasons. I mean, some of it has to do with the season, the winter, the shorter day, the daylight and so forth. But then obviously, the lifestyle, the choices that people make, the
Mm-hmm.
overeating, the emotional eating, the drinking, has plays a role, and then the social factor, the social stress. I mean, the holidays are a fun time. It's a time of family, but as most people will admit, if they are honest with themselves, it is also a very stressful time.
Mm-hmm.
Whether it's just putting on the party, whether it's the conflict that you have with a particular relative that you now have to navigate through. I think that the holidays can truly be a time of great stressors.
Yeah.
And so how do you combat that? How do you navigate that? Number one is to recognize it. Okay,
Right.
recognize that, hey, okay, this is going to be a challenging time for me.
Mm-hmm.
And then be able to make light of it, be able to laugh about it, be
Yeah.
able to minimize the impact. Okay, so what if I don't have the perfectly laid out Thanksgiving dinner,
Right.
right? What if the table setting isn't just beautiful? What if Uncle Matt doesn't get along with Aunt Amy?
Right.
Those don't need to be your issue, right? And so
That's true.
learning
You're
how
making them into
to,
issues with your thought. This is when you have to do
yes,
this, one of these things, right? Like pause.
that's
Does it have to be this perfection in this particular way? It's only your mind's idealized version of it that you're shooting for, right? I mean, because I have to have the Martha Stewart thing, and everyone has to have a placard with their name on it written in gold script. No, it doesn't. You
right,
know,
right.
Print pause, no placard. It's okay.
So learning to let go of a
Yeah.
lot of these expectations, a lot of these beliefs that you have about how it's so important to have that perfect, whatever, is really key. And then just remember, the holidays are for family, for love, for showing appreciation and
Yeah.
gratitude. And so the more that you can just again stay in those high energy vibration,
Yes.
that's how you're going to minimize your stress.
Yeah, so when you do Uncle Sam's really bothering me because it's like pause, you know, is your thinking about this really going to make this about the spirit of love and connection
Right,
during the dinner? Or is this thinking, whatever you're doing about, Uncle Sam, going to cause you to get out of the moment
right,
and, run amok?
right.
So I think that's, and
Yeah,
mostly what it does is gets us to run amok. But I think that being able to at least know that when you, at least, it's part of it is like you said, it's your 7% of your conscious mind going, oh yeah, 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 yeah. Oh, I need to stop. I remember talking to Dr. Thaik, and she said, Dr. Thaik said, don't be super perfectionist. It's, you have an
that's right.
idealized expectation. One of the
That's
other, I
right.
actually just wrote a holiday guide. I think it may have 50 tips. It's gigantic. So if you go up to my website, firedupwithcj.com, I have a holiday guide. And one of my all-time favorite ones, which I'm sure you would appreciate as a Buddhist and someone who meditates, is to take those times when you're sitting in line and are feeling really irritated and just say, Ah, this is a perfect time to hit pause and just meditate. And I've been doing that ever since I've been sitting in grocery lines. Instead of going, this person is taking forever. Really? You're going to pay credit card? Now you're going to pay cash? Like, oh my gosh, get out of line, you know? Now I'm just, look at the pretty light. And then sometimes I'm glancing like, oh my gosh, she's still there. but still, but still, just using those, those times, any downtime as a way to kind of
Yes.
center and focus. That was one of my favorite tips. So, what are some of
Yeah.
your other tips for holiday
Yeah.
stuff?
The holidays is a great time to remember about forgiveness. Okay.
Yes.
Forgiveness to yourself for all the things that you didn't get accomplished that year, all those expectations. And forgiveness to other people, both loved ones as well as, people that are what is it the Dalai Lama says, my special friends, right?
Mm-hmm.
The people who really
My
challenge you.
teachers.
Yeah.
Yes, my teachers.
And yeah. And then, the biggest thing for me though is exactly what you just suggested. Is just bringing yourself back to the moment, being centered, being present.
Mm-hmm.
That works for me every single time, and having gratitude in that moment. Okay, and so
Yeah.
tying that being present with a thought of gratitude.
Mm-hmm.
Yeah, that
Yeah.
will always shift somebody.
Yeah. And I think it's actually the thing I was thinking about the other day is that I was thinking about gifts, and the holiday season is kind of interesting because I don't know if you've ever read the five love languages, but they talk about different ways that people demonstrate their love for other people, and gifts is one way. It's a way for like sharing what's in their heart to another person's heart. So what do you do when you get, something you don't like? You're like, oh, oh, sock puppet, thanks. I love it, or whatever. But if you kind of think, if you get to the point where you think, no, it's really just about, this is all just about love. Now, I may not like the way they express their love, but it's about love. Like, how can you take the sock puppet and go, yeah, no, no thanks. Like, you can return that love and get another kind of love that you like. But I think it's like recognizing at that moment when you open up the gift and it's not what you're expecting or whatever, going, this is this person's way of expressing love. And for a lot of people, it is through gifts. They can't do the
Yes.
affirmations or the other things. So I was thinking that that's one of the most, one of the things I didn't have in my holiday guide that I think is actually pretty important, I think, is to recognize these are all the dinner and the exquisite, beautiful preparation of the food. It's about love. It's sharing yourself through food. I mean, the
That's
whole
right.
thing is ultimately about love, right?
That's right.
Yeah. Any other holiday tips?
Just appreciation.
Yeah.
Really, appreciate, and not just the big things, but the little things,
Yeah.
right? Noticing, the smile, the
Mhm.
kind words.
Mhm.
There's so many things that you can do to again share that holiday spirit.
Mhm.
Um,
And you'd be surprised how often those few words make such a huge difference to a person's day. Like you could
yeah.
say, I was really noticing. We had this woman from Comcast, and I said, you really care about what you're doing. I can tell that you're trying to do things with excellence, and I really appreciate that. And her whole face just lit up, and I wasn't trying to do anything. I was just, because I'm a coach, I'm noticing, and I'm noticing that like effort and energy that she's putting into doing things, and just those
Yes.
small things, whether it's the Comcast person or the coffee person or the bus driver, all those little things I think are kind of,
Yeah.
they're like little mini gifts that are
Yeah.
beyond anything you could ever buy to and give that person. It just makes that person feel good on the inside, I
Yeah.
think.
It makes me think about Wallace Waddle and the science of getting rich. Be a person of increase, and that's really what you were doing,
Mm.
is being a person of increase, right? The recognition that at any moment in any day, you can be a person of increase and
Mm.
increase, the energy and the vibration and the love, and extend it to, anyone that's in front of you. And because of the law of reciprocity,
Yeah.
right, it bounces back to you, and that you know your day, as you probably recognize, was elevated as a result of what you gave,
Yeah, it
right?
was. Well, yes, it was because I felt she was so, oh, thanks, or, and I thought, oh, wow, that really meant so. And then, I'm just saying it because I notice it and I'm saying my truth at that moment, but you could tell it made her day, which then made my day. It is a reciprocity. The reciprocity is definitely in place. And I want to go back to the forgiveness thing because I recently just did something with forgiveness, and I was thinking about the things that kind of do this thing, right? That sink my energy down. And there are probably 5 different people that I look back in my life and say, I really regretted the way I treated this person. And if I could only do something differently, I would do that. And here's the great thing about social media. I was able to look up these people's names and I would send them a Facebook note. And I said, I've held this on for years and I just want to tell you that I'm sorry. I'm not even sure. It was a point in my life when, this was happening, and I'm not even using that excuse. It's inexcusable to the way that I treated you, and I'm really deeply sorry. And it was just, I sent all those emails out to those 5 people, and I've got to tell you, the burden, I just felt so free, because forgiveness is something you do for your heart, and then also for the other person, clearly, but it's the burden and shame and guilt that you carry inside for such a long time. I mean, I'm now 50, so I'm carrying this 50 years of, or, probably less than that, because some of them happened 20 years ago, but I'm carrying that around in me. And when I did that,
it's free. It's freeing. It's a release. Okay?
Yeah.
And forgiveness is exactly that. It is for the person.
Yeah.
It's for you, the individual that's doing the forgiving.
Yeah. It felt so good.
Yeah. And no matter how it's received, it doesn't matter, because the act is in the release for you. Right?
Yeah.
And then obviously it's going to have a positive benefit.
Well, interestingly enough, in terms of how it was received, because I didn't know, I was thinking I could just be opening up a can of whoop ass, I don't know what's going to happen. So I sent out these 5 emails, and one of them said, I don't even remember what you're talking about, but I'm sure it's fine. I don't even remember. That's how much it didn't matter to me. So don't worry about it. And then the other person said, yeah, you know what? I've changed, you changed, and I've never thought twice about it. Everyone wrote back, except for one, which I knew was, I wasn't sure if this person would ever forgive me. And I said, it's okay. I said, if you don't want to respond back, and all of them, I'm like, don't feel like you have to respond back. Because I didn't want to feel like pressure. If someone forgives, you feel like it has to be reciprocated. And in every case, I said, you don't have to respond back. I just want you to know that this is how I'm feeling. And only in one case out of those 5 did I not hear back, a kind of I've forgotten about it. I don't even know what you're talking about. So this thing that I'm carrying around for years, no one even cares about. So it's that's one of the best. And going back, it's one of the best gifts that you can give, whether it's your relative or a friend or, in my case, they were work associates, a college roommate, a high school person. I mean, it's just all over, because usually people are kind, because they've done the same thing. They've done awful things and said things that they regret to other people.
That's right.
So I love that forgiveness, gratitude, and then sharing your appreciation for other people.
And then really soak in the music and the dance and all the physical signs of the holiday spirit. I mean, I think that really does a lot to lift the energy. Okay, so movement, right? The dance. We forget those things. Laughter. I mean, you've laughed so many times during this interview, but that's so cleansing for our body.
Yes.
And when we talk about something physical that you can do as a stress reducer, have a good hearty laugh every day. Just laugh for the sake of laughing, for no other reason than to just laugh.
I did that one time. I took a yoga teacher program, and they said, "Well, start the class." And I said, well, we're going to do a laughing yoga meditation. And it was so embarrassing, because if you just start laughing out loud for no reason, it's very embarrassing. So I just had this ridiculous loud laugh. I was like, oh, so you start off, you go, ho, 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 ho. It's just stupid. But I've been sitting in this yoga class, and I was like, ho, 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 ho. I'm like, everyone, you have to join me, because I'm going to feel bad. So then I had all these yoga teachers, they're all going, ho, 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 ho. And we did this, And then by the time the end of this 5 minutes, all of us were just laughing hysterically because the whole
Oh,
thing was so preposterous. But even that fake laughter generates an authentic, real laughter, which I wouldn't have expected. I just heard
that's
it on
right.
an NPR thing. So because I'm the constant explorer, I'm like, yeah, let's use this for the yoga class. Let's just see if this works. And it does. It's pretty, I think
It,
it's very cool.
yeah,
So even start laughing in your car, start going
yes.
ho 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 ho, and then see what happens. You'll be in the holiday spirit as well as probably laughing shortly thereafter. All right, so drcynthia.com. When can we find on your website? What kind of info do you have on your website that people may
Yeah,
want to check out?
yeah, you'll find lots of blogs on there, centering around the topics of nutrition, fitness, and cardiac health for sure. But I talk a lot also about the mindsets and the importance of things like laughter and music and appreciation. They can certainly find out about our coaching program. Oh, I also have a couple of detox programs that I
Oh,
really
cool.
want to offer for your listeners. They're actually currently marked down at half price, but
Oh, cool.
we do a physical 3 week physical detox program where my nutritionists really take them through getting rid of the toxins, things that we know are highly allergenic to our body, and
Mm-hmm.
then support them with recipes and menu planning to really eat clean for the next 3 weeks, including daily email support.
Oh,
And
cool.
that's really just a fabulous program that I find that patients, if they're able to extend that as a lifestyle and really take it out, and
Mm.
I've had patients lose 30 pounds, drop their cholesterol by 80 points. And so,
80
again, it's
points?
yes,
Wow.
absolutely. Here's the thing. Here's the thing. We're so quick to go to drugs, okay? But the truth of the matter is that if we truly wanted to be, if we set an intention and claim responsibility, I'm responsible for the outcome. There isn't anything that you couldn't do or shift, right?
Yeah.
And that's just the truth of it,
Yeah.
right? I mean, we can talk about, meal replacement programs and these fancy programs to lose weight, and certainly we have those in our office, but good, wholesome eating and being mindful
Mm-hmm.
and being present and really just setting that intention is
Mm-hmm.
the key.
Yeah.
Um, and so,
I'm so glad you said that because my husband literally he went to the doctor today and he's at 5% likelihood of having his cholesterol levels got raised by 7 points, I guess, from 3 years ago, and he was told that he has 5% likelihood of getting a heart attack in the next 5 years. And he said you're on a cusp because if it's 5% or lower, we say don't take the statin. If you're 5% or higher, take the statin. And he's like, well, I'm at 5%.
yeah, what I would say to him is we now know from very good research that high cholesterol is actually a marker of inflammation. So if his cholesterol is risen, that's because his toxic burden and his inflammatory state of his body has risen. So before you go on drugs, I would urge him to think about alkalizing his diet,
Mm-hmm.
okay, shifting the pH of the body. Think about investing in a 3 week detox program. It is simple. It's
Right.
just making a
But then it's a
decision.
but then it's a lifestyle, right? It's not just
It
the
is a
three. It's not just
lifestyle.
3 weeks and like, hey, I took the cholesterol test and it's actually lower. It's
That's
like,
right. It is a lifestyle,
yeah,
but drugs are a lifestyle too, right? I mean,
yeah, that's
so
true.
so patients, if you go, you're going to be taking that for the rest of your life. So
Right.
what is the better choice for you? To
Yeah,
change your diet or be on a medication for the rest of your life?
yeah, that's a good point. Well,
Yeah.
thank you so much. I know we've got to go because you have a patient probably right now. So we
Yes.
have Dr. Cynthia Thaik, and we've been talking about
And
her
don't
book,
forget
Your
about
Vibrant Heart. Yes, hold it up again, please.
uh,
Your Vibrant Heart, Restoring Health, Strength, and Spirit from the Body Score. Thank you so much. I love your work.
you're welcome, CJ.
Okay,
Happy
thanks. All right, happy
holidays.
holidays to you. Take care. Bye bye.
Bye bye.
It means so much to me that you're listening to the show and would love your support in any way by giving me comments below or to subscribe to the show or share the show with friends. Thank you again for your support. Love and blessings.